Last year, we went to the Navajo Nation and helped Animal Rez-Q geld stallions during their equine welfare event. This year, we're headed back to help even more. We're bringing Dr. Nancy, we're covering all the gelding cost again, we're covering the deworming cost, and a whole lot more. You're definitely not going to want to miss this amazing adventure we had with multiple veterinarians and veterinarian students.
Did they make it safely through the airport without getting a broken bottle? Anything of that?
So this is the lidocaine.
And the other wormers. So as you can see, everything, I even included the STS sheets in case there was a bottle break so nobody would panic at the airport. 1 bottle of lidocaine unbroken. 2 unbroken. 3. I had to do a multi-code just for the fun of it. 9 intact bottles of lidocaine, and this is like gold at this current point in time because it is still in short supply. Veterinarians cry when they break a bottle, and we've managed to fly out with 9 unscathed. Our Exceed, still in the box, but within the box, carefully vet wrapped. And I don't see a note from the TSA, so apparently I wasn't a suspect this round. 1, 2.
I recognize you got from the video last year.
Yeah, so I was here.
I'll probably learn more from you all than I could even teach you, but I'm very excited to be here.
We've had our first initial meeting here, but now we're all going over to Glinda's to learn some Navajo culture. We're going to have a supper together and some special things.
Being out 20 years now, I can still learn from the vets that are here, also from the vet students of the things that have changed, coming out new, so I'm looking forward to it. I kind of feel like a vet student in a way of, because again, this is all brand new to me, so I'm learning just as much as the vet students are.
And this is your first time out in this region of the United States. So.
Yes, first time in this whole area, so it's a whole getting used to everything.
I'm excited.
Good morning, everybody.
We just got set up and there are already horses arriving. So this is our first day with boots on the ground for this event, and all the vets are getting acquainted with the vet students and their duties lined out. Dr. Nancy's gonna be helping with the anesthesia side. We've got castrations and farrier station and dental station, so it's going to get very busy here very soon, and I'll be excited to see so many different horses getting help and vet students learning.
It's not about how hard you scrub, it's not about how many times you use a piece of gauze, it's about how long in contact to actually kill the bacteria, right? So you really need 5 minutes of contact time to truly sterilize a surgical incision. My role is sort of do whatever, filling in wherever needed basically, but also teaching, working with both the animal science and the veterinary students that are with us this week.
We're getting ready for the first castration of the day. I think we're going to have a couple different techniques that we're going to see today, so we'll see what is behind door number 1.
We're giving him some sedation here in the chute so that we can get him nice and sleepy, so we can give him an induction medication to have him fall all the way asleep. That way, once he's all the way asleep and laying down, we can get started on a castration for him. He's not super happy to be here, so we were giving him some drugs here in the chute to help him relax and calm down in as safe an environment as we can for everyone, including him.
So the idea is that as I'm twisting, I get that sort of a twist, okay?
Right.
If I keep constant tension, I get a beautiful twist, and it will start to crimp. Actually, here, give me your fingers.
Yeah.
Yeah, let's do it on an inanimate object so we won't hurt anybody. Okay, so if I'm doing this and I'm twisting, I get a really nice consistent twist, and where my tension point will be is there.
Yes.
Okay, but if I let go of my tension, let's see if this is long enough to do. If I let go of my tension, what it does is that.
Yep. More
Okay,
distal.
and I can't recover that. Once I've got that, this is where it's going to break instead of there. So I want the most distal portion. So if I have my constant tension, where I will force my break is furthest away from the testicle.
Gotcha.
Yep. Okay.
Yep.
But when I release my tension, that's what
Then
happens.
it changes your point tension.
Yep.
Makes sense. Thank you.
1, 2, 3, go. Watch your feet. Good.
You want to do him right here?
Let's do him right here.
No, I think we're good here. Yeah, you can be here, but see, this has got you pretty secure, right? So I can be here, or I can be here. Okay. I prefer to be here for obvious reasons, but I don't want to be right over top of a foot.
Gotcha.
We have a lot of goals. For example, I love teaching kids. I love, at the beginning of the week, watching vet students be frightened to death of a castration that are doing it today on their own with very little supervision. I think that the confidence that you start your veterinary career with is a reflection of how much clinical experience you have.
And then I try to do mostly a blunt dissection across it, between my clamps, right above my clamps. And you want to keep track of your gauze. You don't want to be losing your gauze up in your incision. So he's moving a little. So what I'm going to do is I'm going to back off my stimulation.
Yep.
They're giving him more drugs.
Okay.
So I'm just going to back off my, the more I pull and squeeze on his testicle, the more stimulation I'm giving him. So if I back off for a second and don't do a lot of manipulation here, it'll give a chance for the drugs that they just gave him to work. If I keep stimulating him, I'm going to be working against my anesthetist, right? So I don't want to do that. So you can see that I've got the cremaster muscle here separated pretty nicely.
There's really no substitute for hands-on training. We can sit and talk theory all day long, but if you really want to learn how to work with the animals, essentially what I like to say is you've got to learn to read the animals that you're working on. You want to understand what their different reactions are, what the different types of reactions that these horses have. Taking the time to sort of watch an animal, observe what its reactions to the various stimuli are in its environment.
Or I'm going to switch places with you because you're going to do this testicle. So I think you can go ahead and start stripping that second testicle.
Oh, right here.
Yep. So watch your hands. Keep your hands tipped up. There you go. So that you're not dragging yourself across that dirty area.
Dirty.
Yep. Tear that right apart. Yep. There you go. There you go. There. Now you're making progress. See the difference?
Yep. Dr. Neal, is he pulling on you all?
Nope. We're doing great.
Thank you.
It's really interesting seeing that type of gelding. It's really awesome when a lot of veterinarians can get together and learn and teach students because there's always things that are changing and new ways to do something. So it's really neat being able to be here and see some of these and learn from the very best.
So I don't want to be at a weird angle. I want to be at the same angle that testicle is coming out of the inguinal canal. And I want a constant tension, a consistent and constant tension. I'm not pulling, because especially if I have a very young animal or a mule or donkey, I'm going to rip that testicle straight off. Okay. I don't want to rip it off. I want to twist it off. The procedure that we just did is utilizing an instrument we call the equitwister. I do a lot of work in developing countries and in areas where there's very few resources. So we're not going to be able to sterilize instruments in between castrations. We consider castration to be a clean procedure, but it's not a sterile procedure. It's a clean surgery. We don't want to be introducing dirt into the incision, but we know we're going to leave the incision open for drainage. We're not going to do a closed procedure where we suture the incision closed. And so we're going to leave that open for drainage. because we know that we're likely to have introduced at least some degree of contamination with our procedure. And so to prevent that infection from harboring up inside, we leave the incision open for drainage. This instrument allows me to remove that testicle in a fairly rapid but very controlled manner. And it twists the blood vessels as the testicle is coming off in a way that's going to keep that blood vessel from bleeding.
My name is Alexandria Vaught. I'm a third year at Midwestern University in Glendale, Arizona. I joined today and got to do my first open castration. It was pretty exciting and slightly terrifying, but exciting. I think it is probably the most important aspect of my education because you can read books, you can study a PowerPoint over and over, and none of it's really going to click into place until you're actually doing it yourself. I think it's the best part of learning, to be honest, is being able to get out there, get your hands in it, and kind of take it by the ears.
I think as a veterinarian in training, it's something that we can learn in theory in the classroom in a didactic setting, but being able to be in the field, especially in this kind of environment, and learn from our patients, from our clients, from our experienced clinicians is one of the best ways to get better and learn how we're going to do this on our own. So it's an invaluable experience. Good boy. You can get up? Yeah? Good boy. You're okay. You're okay. Good boy. Boy. Good boy. Good boy. Yeah. Got it. He did great. He stood up really nicely. It was really smooth. I'm happy.
These are the canine teeth. See how they're stabbing into the tongue here? And see how it stabs into the tongue there? Yeah. Now your bit is going to go here. So it makes the tongue go like this. Just very sharp. Very sharp. See all these sharp teeth along his tongue? Now feel the outside edges of those upper teeth. Oh yeah. See how sharp that is? Yeah. So he has every reason to kind of not be comfortable in a bridle. So if you see him build that tartar up, and you know you're in between dentals, you can take a little pair of pliers, okay, and very gently put it right on the tooth like this and just twist it. Look at that. See how all that tartar just came off? My goal here is to educate. Again, we have to bring the younger and younger people along, as owners as well as students. The more we educate horse owners, the more that they'll go and educate their friends, their family members, and we just pass the word how important what we're doing today is to help these animals, and it also helps the owners a lot too.
I brought my horses Jim and Luke out for dental and vaccination. I think it's really important because the reservation is really big and we don't get a lot of these services in a lot of our areas, and it's kind of tough to just travel like far out places. Like I had to travel an hour just to get here to Delcon, and I think this is probably the closest one. So, and a lot of these services, if you go to like vets outside the reservation or even on the reservation, they're so pricey, and that's what makes it hard. But this one was pretty okay pricing, so that's what made me come out today.
And what did you say that caused?
Somebody tying their horse up with a bridle and the horse getting spooked and setting back, or old training methods where you tie the horse's head down between his front legs with a bit. I see this more often than I'd like to. So please do not tie your horse up with a bridle and do not tie his head down between his legs. I also like the students to get hands-on. So a lot of times after they've watched me a few times, I'll put instruments in their hands and talk them through a procedure. Hands-on is very, very important, which I don't think they get enough of that while they're in vet school or equine science classes. So this is a great opportunity to get the hands-on.
Hi, I'm Kat, and I just got to extract my first wolf tooth. So we extracted both of those. We're able to extract a retained root from a baby deciduous tooth, and I got to use an elevator and some pliers to kind of pull them out. So it was really exciting to be able to take my first tooth out. So I'm super excited, and it totally recharged my whole day. So.
Was it like cactus? Was it
What do you think?
like from a tree?
What do you think, Susie? I'm not too.
Oh, you're not no, she's not ready.
She's not ready.
She's not ready. How about a little midazolam for our friend?
Well, or just some Torb.
Well,
She's got
when you I mean, just saying
to add that to my induction.
Since she's had so much stuff today,
Yeah,
just
I mean,
to smooth things out. I don't know.
Yeah.
I like midazolam.
Well, and it'll keep the muscle contractions back there down a little bit too.
So our horse, they're just fenced up, regular fence. One day she had a stick in her hind leg, and we went to go get some stuff to go clean it out and make sure, you know, if we pulled the stick out, if it was bleeding, we could clog it up. But by the time we got back home, the stick was already out. So we went and we gave her some penicillin for the wound, and then we went to go clean it for her. And then we finally were able to take her to the vet in Chinle. They opened it up, they opened the wound back up. They put in 2 drainage areas on her back leg. Healed up from the bottom, but it's still, the wound itself was still oozing out, and it's still really pussy, so it didn't really heal. So now they're opening it back up and see if we can find something if it's still stuck in there, and hopefully she can heal.
You're gone?
Too, huh?
It's still deeper after that?
Oh yeah.
Wow.
Yeah, and it's all I mean, you know, she's got this hunk of necrotic tissue right here.
Do you want to flush one just to see if?
Yeah, here, give me that for a second. We'll get a lot of bleeding because there's some granulation tissue and stuff. But what I'm thinking is just enlarge this up this way. But I just want to see where it's going dorsally in terms of the scar, because
that's where the mischief might be.
Yeah.
Because that's where it's draining.
Right, and I mean, it's tracking straight up into the towards the pelvis, you know. Okay. I mean, see, this will track right down to there nicely.
Yeah.
So we can put a drain back in that way.
Right.
The question is, can we find anything that's going to make
at least open up some of the granulation pockets?
See where I'm going?
Yeah. Up.
Mm-hmm.
Whoa. Okay. Yeah, I can't even get in it farther.
No, so
my knuckle gets stuck. But that's
a track.
That is a tract. That is a tract.
So I mean, I don't know if we want to just sort of take the scissors and open, like I'd kind of open this whole piece. I mean, I know we're cutting a bunch of. I mean, this is not even muscle. This is scar.
Scar tissue.
But I've got to the top of where I feel comfortable going, and it's really I mean, come feel this. And then it kind of takes a, ooh.
You got something?
Oh,
that's exciting.
Ooh, come here. Go. I got to the extent of my finger, and it's curving off to the left.
Okay.
Or turn your hand over maybe, and feel that going up to the left. Do you feel something rough in there?
Yep.
I feel something rough in there.
You can get forceps on that.
Right.
Do you have a top off in case we need?
Let's give her a little something. I definitely feel wood here, or what I'm assuming is wood. There's a piece of it.
Oh my God!
That's not it. I mean, but that is a fragment of it.
All right, I'm gonna get. So
did you guys all hear the history on this and understand what we're doing? So there was a draining hole here with pus coming out of it. So 6 months ago, they found this mare with a stick sticking out of her butt. And then when they went to try to get it out, the stick was gone. 3 months ago, if I'm correct, they had taken her to the vet because there was a draining abscess here. They explored the wound but did not find anything. Put a distal drain in that healed, but the proximal wound continued to drain pus. And so now we're at 6 months, with a draining tract. So we decided that an exploratory was our best option here. What else? You know what? Oof, I don't know if I want to stick a dental instrument in here, but if something to grab this thing with, what else do we have to grab? Because these aren't doing it.
Straight hemostats, like even some mosquitoes, right?
Well, no, it's too big. It's what I mean. I'm bending these on it.
Oh, jeez.
But it's a chunk of wood. I mean, I can cut. I can do a bit more of a cut. That scalpel blade or another one, or the scissors. Actually, the scissors.
Who's got the scissors?
Let me try that. Trade you. This is impressive. I wonder if she couldn't get rid of this thing. This thing's big. It is not a small object.
Whoa, you got it? Whoa!
Oh my God! That's awesome! Wow!
How about a flush?
Okay, somebody take that. Let's not forget our patient, you guys. Let's keep quiet, please. Take those. I'm going to change gloves if somebody's got a pair of gloves for me. I want, yes, please, because that helped a lot. I just want to make sure there's not pieces of that still inside here if I can find any.
But look at that.
Told you it wasn't small. I'm like, there's.
I could feel the very tip of it. I'm like,
where is it?
Did you get all that?
Good job.
See the thing in her hand?
Wow, awesome.
Right?
That'll heal.
Yeah.
Wow, I can't believe that.
When you've got a pocket of pus or infection that's coming out of the top of a hole, like so if you think of that as like a purse, you're never going to get a really good clean result unless you make a hole down at the bottom. We call that ventral drainage. Anytime I've got an infection that's lasting for that length of time, in all likelihood there's something up inside there that the animal is unable to get rid of, and that is serving as a source for that infection. And so we elected to lay that mare down under general anesthesia and enlarge that upper wound to try to follow where that infection was coming from to its source. When I started to extract it, I realized how large it actually was, and when we pulled it out of there, it was, about a 4.5, 5 inch piece of wood. We did try to put some stitches in the top where we'd made such a large incision, but I'm not worried. That wound's gonna close on its own now pretty nicely. And then we put a drain tube, a plastic tube, going from the bottom part of the draining that was already there, and I utilized the hole that the veterinarian previously had made in that and made a tunnel under the skin to that, and just made a loop with that tubing so that the infection has a pathway out of the body. And that'll keep that infection from harboring up in there, keep those blood clots draining out of there, and allow that wound to heal faster and cleaner.
Really crazy. It's a good, 4 inches, 5 inches. Very happy, because like I said, we took her to the vet already, and they said there was nothing in there, but this was in there. So hopefully everything will be good and she'll heal up, and next year you guys will see her again.
Ourselves up to get down to business, baby. I am sharpening my hoof knives because we're getting ready for some trims here on the Hopi reservation on the clinic here, and looking forward to them coming in. What this overall conformation looks like compared to the limb conformation, and then you pick up the foot and see if that's what it looks like where it's going. Do you know what I mean? So you want to try to keep him as natural as possible in the plane that his foot is, like a natural balance like they do over there in the LPO. Thought I'd throw that in there. Come on, pick your foot up. And I'm just gonna clean up some of this frog. A little bit more. I like to leave some frog because it's good for him, but his is all boom boom. But since we're gonna go barefoot, we're gonna round him up a little bit. So I'm gonna come here and go around the whirl. And don't try not to do this if you don't have to. Usually it's this way. And when we set it here, we want to have a little space at the point of his frog. When you come to the reservation, you understand there's a whole different perspective on what the people feel about the horse itself and what the horse gives them and what they give to the horse. And I found that since I've been on the res and looking at the majority of the horses that I've seen, they really look good, their conformation's good. Of course, there's some that we have to work on and do that, but generally speaking, the horses are kept up real good. The people have a whole different attitude about working on the horses, and it's a pleasure and an honor to be able to work with the people on the reservation and on these horses.
I am impressed with all the work. Every little station is very important, and it is going so smooth that I am impressed with the work and the people that are doing the job here. And I thank each one of them. And thank you, Jack, for
Oh, Daisy, you know what? I can't thank you enough. And that's true. I mean, and it is good that we can bring this to them. And I'm going to try to bring some more things onto the res, get with ELPO, talk to the people, and see if we can get the res on a routine to keep the feet up.
So I'm just bringing my nippers around and trying to bring this hoof wall down to the plane, the sole plane. You want to be careful though. You don't want to take too much sole because you don't want to sore them, you know. They need a bunch of that underneath them, especially if they haven't been done in a while. And you take a bunch of foot, and even though they need the foot to go, I like to leave them up quite a bit because I don't know when they're going to be trimmed again, you know. It's kind of the same thing with the frog. You sort of feel for kind of like a spot where you feel like it wants to be shedding, you know. I think if you have a trade or a profession in which you can be of service to others, then you need to do that. But also, I think it's really, really important to teach and to inform owners of their horse's hoof needs. Not only is it better for the animal, but it's better for the person, right? A lot of times people don't know. So the important thing is just to provide information, especially out here in the res. It's real rural. They don't have a lot of access to people that do proper hoof care, and sometimes they can't afford it. So if you can do that, if you can provide that service, then I think you should. They look really good, actually, considering I don't know if this is his first trim or not, but it looks like it could be. He looks pretty young, but as far as cleaning him up, this is going to be the easy trim. But it's important for young horses to get regular trims, just like adult horses. There can sometimes be a belief that they don't need them until they're 2, but you really want to start them as soon as they basically harden up.
Like when you go to the doctor, they take your temperature, measure your pulse, they listen to your respirations. Same thing for the horse. We're going to do that. Sure. So hey, have you got to listen before to the heart? Oh, well then today you're going to get the chance, all right? Okay, so her heart rate is very slow. So go ahead and take a listen there. And it's real slow, so you got to be patient to hear it. It's not like ours. I love the Navajo Nation, the Hopi Nation. They're my neighbors. And I was just very excited to hear they needed somebody to come up and help for this project. So when they asked for somebody to come up and help, I was just honored to be able to provide whatever I can.
Okay.
Can you hear that?
Yeah.
Yeah.
Real
So
slow.
boom, boom.
Yeah.
So usually when you're trying to learn to listen to the heart, you got to be patient because we're used to hearing blah, 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 blah.
Yeah.
So you're there, I don't hear it, I don't hear it. and you keep putting your thermometer back on a rib, and you're never going to hear it on that.
But at
So
least I know where it's
that's
at,
it.
right
So
there.
you feel that right there.
Yeah.
That's the point of the elbow.
Okay.
And then feel the ribs.
Yeah.
The ribs are wide. They're like an inch.
Yeah.
So you got to remember you're looking for a space in between it.
Yeah.
The left side, you're closest to the heart.
Okay.
You could hear it on the right side, but it's easier on the left side because the heart is closest to the body wall, so it's just easier to hear. Right. So if you're interested, find yourself a stethoscope and practice on her on a good day. And it's easier if she's awake and more excited because it'll be going faster and stronger. Right now, she's still taking a nap.
Yes.
The interest you get one of these and just practice on your horses when they're healthy. You don't want to go out there when they're sick and try for the first time. And that way, if you have to call a veterinarian, I don't know who you call, if you call Dr. Scott down in Winslow, Dr. Ruby, and you say, Dr. Ruby, my horse is doing this, it's off her feed, I take her heart rate and it's 54 or it's 72, right? And then that helps Dr. Ruby help you know what to do next. Like, well, you better get on her trailer or, give her some Banamine or whatever, Dr. Ruby would recommend. So I'm passionate about rural area medicine. I really like being part of the community. If you're in a bigger city, things get more specialized and I don't feel I have the same connection. Whereas if you're in a smaller community, you're really important to that community, and you know your clients, they're your friends, they're your neighbors, and I find a lot of reward with that. All right, so temperature also a good skill to have, right? Okay. So you can get these from the drugstore.
Yes.
Now, have you ever gotten shots? Okay. So we want to give it in the muscle, is what we're looking for. So, and then you can draw that little triangle. Okay. Right? And there's my target. Okay. So that's where I'm well above where that vertebrae are. I'm well below where the nuchal ligament is. Nice target. And you can, like I say, even draw a little triangle, and then I know where to go. Okay. So that's one way to consistently find that. And then so I go all the way to the hilt, 90 degrees, and then I pull back and make sure there's no blood, and then just push it on in. Okay. As an older person now, I'm really concerned, all right, who's gonna take up the reins once my generation moves on? And so to be able to help mentor and give the perspectives I received over the years to the next wave is also a privilege to be part of a project that is able to take so many outstanding students and kind of help them along with their next steps in their lives and careers. I've had some people that have horses that they need medication every day. So I say, well, train your horse to do this. And don't do it when they need the medication. That's too late. So you get an empty one of these, clean it out, rinse it off, and then you can take just a little bit of something that they like, either applesauce or Caro syrup. It's just a little bit, right? And then you give it to them and they're like, oh, I like that. Pretty soon they see you coming out with this and they're like, they come right on over and they want some. And then, so it's a good thing for them. Okay, yeah. Okay, so we'll get her microchipped. We prep it a little bit because you're putting the chip, which is not very big.
So we've already read it, and it is live. Okay. And understand that it is a big needle.
And she got a little sedation, so.
Yeah, she's still asleep.
She's awesome, huh? She make that look easy.
You're good.
Thank you very much.
Thank you.
Now, anybody that's trying to find her, they're going to know where to look. And now practice, and next year you can show us.
Yes.
All right?
Oh, yeah.
Okay.
I'll be back.
Okay, sounds good. You take care.
Okay, it is Tuesday morning, and it is Tuesday, right? We'll start over. It is day 5 of our trip, and we are getting ready to leave the Hopi Reservation. We spent the night at the Hopi Veterinary Clinic camping out, and we are heading to Chuba City today, which is, they say, about an hour and a half away. It's been a really good 5 days so far. A lot of good-looking horses have come through. All the people have been really nice. Enjoyed talking to them, learning about their horses, just normal chit-chat, and being able to help some of the horses. So it's been great.
We're in Tuba City, Arizona, at the fairgrounds.
So it's really important that we can come out here and help the community. So I'm a certified equine dental technician, and with that comes obviously mentoring the next generation of equine dentists. We work with the Academy of Equine Dentistry. So students who are doing their internships can and do come and ride with us and learn, and we'll work them in on horses. So days like this are really good.
He has 2 sagittal fractured teeth, which means they're split the long ways down. So if the tooth was like this, it's split like this, and there has a lot of food debris in between the sagittal fracture. So I'm just cleaning out the tooth and seeing how deep the fracture is, and neither portion of that tooth is loose. This is a fairly young horse. The roots are going to be very long, and I don't believe I have the correct forceps to do this in the field today. So we're going to check with the other dentist and see if he has some better forceps, and probably let him do it.
This horse came to us from another practitioner. I haven't looked yet, I'm about to, but said that he has 2 fractured upper molars. He's got a stinky discharge from both nostrils, and so I'd say that that's probably true. But we're gonna look. But before I spec a horse, I want to work on the incisors, dress the incisors, so we don't get a bunch of chipping, breaking off of. And then the other thing is, along with an extraction, is you want to equilibrate the horse as well. So you don't just yank teeth or whatever. You can leave things sitting hard. So we want to equilibrate the horse as well. So I'm starting that. That's how I always work on the incisors first. Clean up the canines so you have a little bit of a cleaner workspace. So this horse was worked on last year, but I think what happened is he had some pretty significant infundibular caries, and they finally just cracked from pressure, because you can tell that the practitioner last year really worked on the wave that causes the expiration of those upper teeth and puts pressure on them. So I'm sure this is just a natural progression of these infundibular caries. And yeah, we have 2 sagittal fractures of the upper nines. I'll flush around it, behind it. That'll help me determine basically how to go about extracting them, which side's looser. If I'm fighting a bunch of feed packing and stuff like that, it's not gonna be fun. They're split like this, about as wide as you can get. So after I elevate, and they're pretty loose, after I elevate, what I try to do is put the forceps on them and slowly try to bring them together, and then we'll try to wiggle out. So a lot of times extractions are not brute strength. Actually, most of them aren't. They're more technique. Okay, so I don't know if you can see this, but we got the tooth all the way almost together. You can come right up my right shoulder. You might be able to see a difference. All right, so we just took it out in 2. We're going to take it out in 2 pieces instead of 1. So you can see that the root has broke off of this. Not now, but probably at some point. So there's a root tip up in there. Actually, yeah, there's 1. Maybe it's attached to this piece. We don't know, because this piece is being a little stubborn and coming out. It might be attached to that. So no, we've got a root tip in there. So here's, these maxillary teeth have 3 roots. Your lower dentition has 2. So 1 is always palatal. So we're missing a root tip. This is how that goes together. Just like that. Okay, so here's our tooth. 2 parts. Here's the 3rd. Remember how I said that the palatal root, so they're spread like that to anchor them to the teeth. So we're actually going to pack these. with a material plug. When I get the other one out, we'll clean them out and we'll do that. So those plugs will act as a barrier for bacteria from the mouth and then going back up into the sinus. I don't think there's any correspondence or with it, but we do have infection going up through the lamina dura into the sinus. So we just want to protect that from further infection. I'm just mixing these two elements together and it'll heat up and then it'll start getting hard. And at that time I'll make a little tooth out of it, shove it up in the socket. So we pulled both those teeth. I'm packing it right now. We're gonna give him some antibiotic and send you home with a little antibiotic shot for him. Oh, that went really well. Yep. I think the only thing that was even a little bit difficult was just trimming up the dental impression material. This is some that I haven't used this kind before, and it stays really soft instead of hardening. So that was really the only thing I spent a lot of time on, making sure that was trimmed off and you know, that it wasn't gonna catch on anything or cause a problem. So that's about it.
Everybody here has kept up good energy. We have like 2 horses left that we're waiting to come out of sedation to make sure they get home safely, and then we're packing up and gonna keep the energy up for tomorrow, right? Try and get some rest and we'll be back. So.
Today went well. We had some interesting teeth pathologies today. We had 2 cracked molars. Those got removed for the horse, and then we had another one that had a molar removed last year, and actually, unfortunately, it did not heal, and it actually has an opening up into the sinus, so when the horse eats, feed will come back out the nose, but the horse is in excellent shape. So we flushed that out and made some recommendations of management, just continuing like he's been doing, because the horse is not suffering from it, even though it's a little unusual. But great day, rain held off, so we can't complain about that. So we're all tired now, getting ready to make the little over 2.5 hour trip back to St. Michael's.
Today is full. We have 20 dentals, 20 hoof trims, and 15 castrations. So this would be a good before and after pick.
We are in Tehachapi this morning for the last day of the veterinarian services, and there's a lot of horses lined up. I think there's like 20 geldings, 20 dentals, 20 trims. It's going to be a full busy day for everybody, and it'll be very exciting to see how many horses we're able to help in the end.
This is the first time this group has been to this location, so we're excited to see some new clients and take care of the community here.
We're at the Moore Arena, just below the Chusca Mountains, and we're providing our final series for the horse services on Navajo Nation. So today is the wrap-up.
One of the things we really like to have our horses in our community and around surrounding areas to come down and have their service done here so they don't have to travel too far, and the costs and everything is right here. So we're going to try to see if we can have this every year.
I know a lot of veterinarians, they're not in this for the money. You know, this is a profession that you're called to, and being able to see how you can make a difference in people's lives and the animals that they take care of is really, really important. And I think that's one of the best things about me being able to come out here is, you know, I feel fortunate that this is part of my job, that I get to spend the week and work with the students and really connect with the community here. It is so amazing to be invited onto this land that is so incredible and sacred. It has such a rich history, and the horse is so important to them.
We're really excited to be part of this. It's an honor, honestly, to be involved in this. We've learned so much in just a couple days already.
It's, what is it, ESC, so it's Equine Service and Education. So, you know, everybody that here owns the horses, so if we can also educate them on the safe handling and how important it is to do, you know, the deworming and the vaccinations and take care of their teeth and help them age them properly and their feet, so we're educating them as well.
I think the week's been a phenomenal experience. I think that we've got an amazing group. I'm really impressed with everybody that we're here working with. Everybody's really dedicated. They've been just phenomenal to work with, just a real pleasure. The group dynamic has been great. I always learn something every trip, and this trip's been no exception.
This is so important to get the education out there and the opportunity for people to bring their animals here and get them worked on where normally it's not that accessible, to have equine dentists and this amount of knowledge, and veterinarians and students too. It's a win-win all the way around. Everybody here wins.
So it's been really great being here with Animal Rez-Q and Glinda. She has such an amazing organization helping so many horses and other animals as well. But this event was gauged towards horses.
So the horse services on Navajo Nation, they're non-existent as far as distance to travel and hauling horses. So bringing the services into communities is the best option. And thanks to Horse Plus, we had castration supported last year, and then we also have that support this year, and we are very happy about it because of the feral horse population on Navajo is huge, and so we would like to make an impact on that, as well as disease prevention that we're able to do with bringing vaccine and dewormer into the communities.
Well, it's amazing, and the gelding is so important because it's ending the problem of the unwanted horse population at the source. So there's so many young colts that have come in here over this week, and to see them go out as geldings and they can live happy lives with other horses, that's amazing, along with all the other services that you've coordinated and provided to these horses.
Yes.
So keep up your amazing work. You're doing a fabulous job, and we're happy to support in a small way some of the efforts that you're doing.
Thank you so much.
You're doing amazing things. It's just been such a huge blessing to be here and see so many horses that are getting gelded through our grant programs, and horses we're able to help. Dr. Nancy's been very busy helping horses, and it's been great to be part of this event with Animal Rez-Q. Glinda works tirelessly to put all these events together, and hundreds of horses can be helped, and that's just amazing. And it's just been great to be out here for a week, being immersed in the culture and spending so much time on the reservation, and seeing so many horses get a leg up to a brighter future.
young people, if you have a passion for horses at all, or livestock, large animal in any kind, and you don't know where to start, reach out to people that are here, because there's so much knowledge. The veterinarians that are here can point you in the right direction. You can come and volunteer maybe, and even if you're just observing and running instruments back and forth or holding a lead rope for someone, it's the very essential to get your hands wet and get started, because it's not going to happen just by having a wishbone on the couch. You got to have a backbone and get out of that box and reach out, and there's people out there. We're here to help.